So IDH1 and IDH2 mutations are known to be recurrent mutations in acute myeloid leukemia. They were discovered in 2009 and 2010, and since then we've learned a lot about these mutations. We know that these mutations occur mostly in patients with cytogenetically normal AML, and we also know that they have certain patterns, clinical patterns. Generally speaking, patients with the mutations are older, they have a lower white blood cell count, and they have a higher platelet count. But very interestingly, these mutations also occur more commonly in patients with NPM1 mutations. And when they were first discovered, and people were asking, well, what is the role of IDH1 and IDH2 mutations in AML? One asks, well, do they have a prognostic impact? And here, it's really a long story to answer this question. The long story being due to the fact that there are results showing that there is a prognostic effect, other data that shows that there is no prognostic impact, and that's something I will be discussing in more detail in my talk. We have a lot of data about the prognostic impact of IDH1 and IDH2 mutations. And most of the data that we have came actually from cooperative groups that published their results shortly after the discovery of the mutation. And here there were certain trials that showed that a negative prognostic impact can be shown in certain subgroups. For instance, the NPM1 mutated group, some others found a negative prognostic impact in the NPM1 wild type group, others showed a favorable impact. But that being said, it wasn't really a clear-cut answer for the prognostic impact of IDH1 and IDH2 mutations. And since those descriptions of the prognostic impact, other mutations were also discovered to occur in AML. And they need to be obviously taken into consideration as well. So 2017, what would I say? I think there's some data that there's one certain mutation that might have a certain prognostic impact, and that's the IDH2 mutation in codon 172. And here, the cooperative efforts from the Sanger Institute and the AMLSG have shown that these patients have a favorable prognosis compared to patients that do not have that mutation. And there might also be certain situations where gene-gene interactions are again important. For instance, it was shown by the same study group that IDH2 mutations in position R140 in combination with DMT3A mutations are probably associated with a negative prognostic impact. But to summarize, I would say it's very difficult to talk about a strong prognostic impact of a IDH1 or IDH2 mutation, with possibly the exception of IDH2 mutations in codon 172.